All right. Thank you, everyone, for joining this LabKey webinar. We will be examining some of the research funding pressures and what you and we can do about it. I'm Adam Rauch, co-founder of LabKey and vice president of product strategy here at the company. A couple logistics things. First of all, this webinar is being recorded. Everyone who signed up will receive a link in a couple of days, follow-up email with a link and some follow-up opportunities with LabKey. Secondly, if you have questions along the way, feel free to put those in the Q&A. I will take a look at that at the end of the presentation. If there are questions, I will attempt to answer those at the end. So with that, let's jump right in. So the situation, let's just acknowledge where we are right now, which is it's a tough time for US funded life science research. I don't need to put a bunch of headlines on the slide or quote a bunch of statistics. You know it, we know it. This is kind of a rough time for life science research. And not just for you, it is for LabKey as well. A little history sidebar, just to kind of make this resonate. LabKey started basically in 2003. My co-founders and I, working as research scientists at Fred Hutchinson Cancer Research Center, developed the initial LabKey system for Fred Hutch, completely funded by an NCI R01 grant. And our focus initially was, of course, on the aims of that grant, but we produced a system that ultimately was useful to other organizations. When we spun off the company from Fred Hutch a year and a half later, our NIH grant funding converted into an NIH subaward that continued to fund our work. And that was the start of 22 years of uninterrupted NIH funding that has sponsored much of our work. And that funding has come directly from NCI, or directly from NIH, several divisions, in fact, of NIH, as well as indirectly through our many, many clients who are funded in part or in whole by NIH. So all of that is to say that we are feeling this pain along with you. We're not just casual observers in this process. And we've had many conversations with all of our NIH-funded clients, which is essentially where the material from this webinar came from. It's really all from them. So obviously, a lot of us are feeling some pain. That said, we are pretty optimistic despite this. We remain bullish on life science research, US funded life science research. We as a company are investing millions of dollars this year in improving our products, creating new products, extending our product line, improving the products based on what our clients tell us, partnering with our clients to ensure that they get the most out of the data management systems and software that we provide. And we really do believe that we'll come through this period. So it's gonna be a little rough time, but we will make it through. We've made it through other economic uncertainties and funding crises in the past in our 22-year history. And we'll do it again, working together. So in this webinar, we've got a couple of parts. The vast majority, as I mentioned, comes from what we've heard from our NIH-funded clients. So specifically, concrete strategies and tactics they're using at this point to navigate their way through this funding crunch. I suspect some of these ideas you're already working on or implementing. pursuing. But I hope that some of them will be new ideas that you can use in a concrete way. And we'll also take a little time to talk about what LabKey is doing, specifically in response to this funding situation, to help our clients and to help prospects, to help those interested in establishing a data management solution, what we're doing to make that possible and affordable and efficient. So I'll start with, obviously, a good goal. If at all possible, maintain your existing funding. If that's at all possible, that's ideal. And what we've heard from our clients, some of the ways and tactics they're using to maintain this funding is to really understand the decision makers and the criteria those decision makers are using to evaluate research funding. So if maybe that's a program officer or an executive or maybe accountant at your institution, understand, talk to them, figure out what their criteria are, and respond to that criteria appropriately. So it's very important that you know what they're using, how they're evaluating you. In many cases, if you're not already doing this, shifting the mindset to kind of a return on investment philosophy. So instead of articulating, here's the number of publications I've produced, or here's the number of samples collected, or participants tested, or what have you, focus on the actual outcomes of research, impactful outcomes that will resonate with whoever's doing that evaluation. What we've heard is that there are a number of what I call kind of hotspots. These are critical areas that the funders resonate with. So, what we've heard is those folks emphasizing the security aspects or regulatory compliance, risks of data or sample loss. Emphasizing those areas can be effective to protecting some of that funding, to continue to mitigate those risks. And then the final thing we've heard is that some of our clients are looking at transitioning their research a bit. So it kind of pains me to say, but there are, as you know, certain research areas that are a bit out of favor right now and some that are more in favor. If there's any way to pivot toward those areas that are more in favor, that can work to your advantage. So beyond existing funding from, in NIH, there are other sources that you can and probably are tapping into. There are private foundations that fund a great deal of life science research. If I look out my window, I can see the headquarters of the Gates Foundation. One example, obviously they have deep pockets. They're funding a lot of life science research. They happen to be a client of ours. They are, as I'm sure you know, they've announced an acceleration of their funding for the entire foundation. They're amping up the number of grants and the amount of money that they're putting into life science research. So this timing is good, and it's a potential source for funding your research. There's also the possibility of partnering with, collaborating with commercial entities. So biotech, pharmaceutical companies that may be interested in your research. There are opportunities there that a lot of our clients are pursuing. So NIH is, of course, not the only government institution that is funding life science research. U.S. military, as it turns out, funds a great deal of life science research. Obviously, they have large personnel deployed all over the world, and they've spent a lot of money researching various areas. And while the military may, this life science research in the military may take a bit of a hit in terms of their funding, it's likely going to be much less than what NIH is seeing. So that is a possibility. And then we see that quite a few of our comprehensive cancer center and research hospital clients, they have grassroots funding campaigns. So literally the bike rides and walkathons and galas that these institutions hold for fundraising purposes, those raise a surprising amount of money. And if your institution is involved in those types of efforts, those types of campaigns, that might be a source of funding that you can tap into. So understanding, again, similar to the previous slide, who controls those purse strings? What are their criteria? How do I go about getting some of that research funding, if possible? And then finally, look for options outside the United States. There's plenty of research funding going on in Europe, Asia, Australia, other places. These are potential opportunities for augmenting your funding. So what we're hearing is that now is really a time when data needs to be protected. So practically speaking, if, for instance, staff ends up leaving your lab or your research institution, are they taking data with them? Are they taking access to that data or the understanding of how that data was collected and what it represents? That poses a significant threat. And likewise, we're hearing that as IT budgets are being slashed, some of our clients are worried about losing access to their systems, to their data management systems, and potentially, those systems not being maintained appropriately in terms of security patches, backups, and the like. So these are some of the concerns we're hearing, and those have resulted in some trends. We're seeing multiple research organizations coming to us saying, now is the time when I need to centralize my data. I need to get it out of spreadsheets and off of laptops and into a system that is more secure, more compliant, and easier to access and more efficient. And likewise, given the IT budget constraints, we're seeing many organizations adopt the cloud. As you know, the life science research industry is not really early adopters of cloud technology, to say the least. Variety of reasons for that. But increasingly, and not just because of the funding issues that are happening this year, but really over the last 2 years, we've seen 90% of our new clients adopting our cloud offerings. We still have on-premise offerings if that's required, but obviously the vast majority of new clients are adopting cloud technologies for all the reasons that we talked about. Economic reasons, it's cost effective, it's managed for them in a very efficient and reliable way. And that's very attractive. So I sometimes feel like I'm preaching to the choir here, but increasingly, we see when we go to new organizations a lot of data in spreadsheets, sometimes paper and pencil. So it's worth sort of reiterating the importance of centralized data management, at least as we see it and as our clients see it. So some core principles. It's all about security, regulatory compliance, and compliance with organizational policies. So collecting the data, securing the data, in particular, right now, protecting that PHI and PII and intellectual property, protecting that, getting it out of spreadsheets and email and other kind of ad hoc data management systems. It's also important for data accuracy and completeness and consistency, making a single source of truth for the data, making sure that that is harmonized and integrated and can be viewed by all the appropriate people, QC'd, and with annotations and metadata to make sure that it can be understood, it can be QC'd, it can, we know it's accurate, and we know it's consistent. And that provenance, metadata, documentation, et cetera, that is, to us at least, just as important as the data itself. A spreadsheet with numbers in it doesn't really tell you much. You really need that metadata and the provenance around that data. And then finally, making sure that that data is regularly backed up, that there are data integrity checks built in, very key to protecting this important asset, your data. We would argue that research data is really the most important, most valuable output from life science research. But of course, it needs to be protected, and you need the story around that data in order to do appropriate analysis and reproduce your science. So these principles are even more important during budget-constrained times, like now. If staffing is reduced, there are fewer people to juggle spreadsheets, paper, ad hoc data systems. A centralized data management system can make you much more efficient in light of reduced staffing. It helps streamline processes, reduces overhead to make sure your research continues. So our main point here, what we hear from our clients, they're self-selecting, but what they tell us is that fundamentally they want software to make them more efficient. So it is about security and compliance, accuracy, and efficiency, allowing them to load data in an automated way. For instance, taking data from an instrument through a processing pipeline into a digestible form that everyone can access, securing that data and making it available automatically without human intervention. That increases accuracy and increases reliability and increases efficiency. So those are the kinds of systems that our clients are putting in place to help them through this period. It's also important, reducing manual data entry. Again, automate that to minimize errors and to maintain reliability of the data. And then all of this accelerates the analysis and reporting steps that are so important. The data is great, but you need to do the analysis, and integrating that data quickly, getting it in place allows for quick and accurate analysis and reporting. So finally, realizing cost savings. Again, our clients look very closely at the return on investment they're getting from the software that they purchase from us, and they are seeing these long-term savings by reducing processes, reducing human errors. This also, especially in the cases where they're using our cloud hosting, Their maintenance costs are lower, their infrastructure costs are lower. They're paying as, as a continuing service, or in many cases, the cloud hosting is included with the product that they've acquired. Again, they can install on-premise if they want, but there's no extra charge if they wish to take advantage of our cloud offerings. So let's get sort of pragmatic here and practical. Let's say the situation is you have several or maybe many software packages that you're using, and you're being asked to reduce your software budget by a certain percentage. What can you do? Well, what we've heard is that our clients are conducting comprehensive audits of their software, understand what each package does, and in particular, identify where there might be overlapping functionality and the ability perhaps to eliminate some redundancy. If you've got multiple packages that have the same function, or one of their functions is common or overlapping, maybe you can eliminate one of those. And there may be a single integrated software solution that can replace multiple of these standalone products. You need to, at this time, kind of look around and see, assess the market and see if there's, some of your older software packages, maybe they're a little outdated, maybe there are newer systems that provide that functionality and more for an overall lower cost. You can also, if you're pleased and happy with your existing software solutions, you can negotiate potentially a more economical pricing from your existing vendors. These vendors are well aware of the situation right now. They want to keep your business, most likely. Some of them may be willing to negotiate. Some of them may not, but it might be good to focus on those who are willing to work with you at this time, and work with you during these budget constraints. I put this point in here. It might seem a little different than the others, but align with vendors that have proven longevity. Why do I say that? Well, in 2025, there will be quite a few software vendors that go out of business. There always are every year. But this year in particular, with the funding pressures, budget pressures, a lot of these vendors who are venture capital backed or private equity backed, they may themselves undergo some funding pressures as their cash flow reduces. Their funding flow may stop and they may end up folding. So it may not be something that you think about all the time, but as you evaluate vendors, make sure you're aligning yourselves with those that have a long history and that have a long trajectory into the future. The last thing you want is to acquire a software package from a vendor who then goes out of business. So keep that in mind. And then finally, there are open source software solutions out there. LabKey happens to be an open source software company. We have an offering. There are other offerings out there. Open source software doesn't necessarily mean it's free. It does need to be installed and maintained and supported through some mechanism. However, open source software can be a very economical solution that might meet your needs. And then I mentioned the cloud solutions. Make sure you investigate those. These can offer significant cost savings over on-premise IT infrastructure, especially as those organizations come under pressure. Cloud systems really offer flexibility and scalability, and help you manage costs. Given the pricing model, typically monthly costs, it's not necessary to buy a machine in a rack, an expensive server, with a database on the side, backup, and everything else. It's all included in a monthly cost, typically, which can be advantageous. So let's talk a little bit about what LabKey is doing to help during this time. So it starts with our products, comprehensive, integrated solutions that handle all of those core principles that I mentioned earlier. So one example would be our SDMS Professional Edition, which includes all of these bullet points. So that would be an example of an integrated system that provides many different functionalities in a single package. So sometimes when I'm talking to clients, existing clients who subscribe already to one of our solutions, they're surprised when I tell them that their clinical trial data management system that they acquired also includes an enterprise electronic lab notebook. It also includes world-class sample management and freezer management built in, that they can actually, we have quite a few clients transitioning from their legacy freezer management systems to the system they already have included in their LabKey solution. So the products are comprehensive and provide excellent functionality, but we also pair that with flexible and affordable pricing options. So every product that we have has multiple tiers, multiple pricing tiers, so you can tailor exactly the functionality that you need with the price that works for you. We've introduced per user pricing options for every single one of our products. We do have unlimited user options. That works well for organizations that have thousands and thousands and thousands of users. But smaller organizations, new teams, new organizations, they can start out with a very small number of users, which makes our products very affordable. And beyond that, we offer volume discounts and multi-year discounts. Right now may not be the best time to do a multi-year discount, depending on what your funding looks like. But we actually have some clients who say, well, I've got some funding right now. I'm not sure if it's going to be renewed next year. Can I buy a multi-year package right now? And we're happy to do that and offer discounts for that. And then, as you've heard, every one of our products, every LabKey product includes cloud hosting as an option. You can use that or not, it's your preference, but that cloud hosting, we host hundreds of servers, hundreds of instances of LabKey. We have the automation, the expertise to make that very, very straightforward and affordable and efficient. We provide all the backups. We update the software itself, the operating system, patch everything on a daily basis. So that makes it very affordable and very reliable. Beyond the software itself and the pricing is our very important support team. So dedicated support that starts before you even buy anything. We will work very closely with you to determine the software package that's in the tier that is most important to you and figure out the optimal pricing option for your situation. Maybe you start with a small number of users. Maybe you start with a larger number of users, which gives you a volume discount. We'll figure out the tier that works for you, the exact product that works best for you. We are very happy to have those conversations and optimize your solution based on your needs. And then once we've engaged with you, we embark on a partnership where we provide expert assistance, guidance, training, to help you make the most of that product. We know in pretty much every case, you need to transition data from either spreadsheets or another system or another database. You need to move that into LabKey, and we provide, typically at no extra cost, all of the expertise to get your data into the system and then optimize your workflows, optimize your analysis, your reporting, for your needs. And that support is ongoing. Our model is we partner with our clients for the very long term. You've heard NIH as an example, 22-year history. Other organizations have been 15, 12, 18 years in engagement. That is how we work as a company. And that is what you'll see from us if you choose to go with a LabKey solution. And then finally, I mentioned this before, the community edition of LabKey. This is our open source offering. So it comes with excellent data management capabilities. It doesn't have all of the bells and whistles of our paid offerings, but it is a good solution to start with. A lot of our clients start with the community edition, get to know it, understand the value, and then move to a paid edition that provides more premium functionality and provides that award-winning support that I mentioned. So this can be a starting point. It's also, there are a couple of clients we're talking to about if they have a hiccup in their funding and they want to maintain their LabKey solution, they could switch to the community edition for a period of time, maintain access to their data, maintain some of that functionality that they're used to, and then perhaps at a later date, move back to a premium edition once they've secured funding. And in addition to the free software itself, we also offer low-cost cloud hosting of the community edition. So this can be a very economical way for those without IT infrastructure, without a lot of funding, to build out a data management solution that works with those core principles. All right, so what's next? Basically, hopefully you can use some of these tips, some of these strategies, some of these tactics to help during this time. We ask you to have a conversation with us. If you're interested in a solution, if you're an existing client and you're concerned about your funding, have that conversation with us. Most of you are already, but make sure you talk to us about your concerns, and we'll work with you. If you're new to LabKey, considering LabKey as a solution, same thing applies. Schedule a meeting with us. We're happy to chat about the different offerings and options. You can see on the right-hand side, I haven't talked a lot about our actual software and systems. Obviously, you can research everything on our website. We're happy to talk to you about them as well, but just to give you an idea of the different packages that we offer. We offer a very wide range of products, from Sample Manager Starter all the way to Biologic LIMS Enterprise and everything in between. So comprehensive solutions that can address all of your data management needs. So check out those software solutions and talk to us about how we can help. And with that, I will check the Q&A. I don't see any questions in Q&A. So there is a chat here. I hope my colleague will not mind me sort of paraphrasing. So one of our clients, former clients, said being able to roll back to the community edition was a lifesaver for us when our funding was cut. We are still committed to using LabKey and may have some opportunities to purchase premium capabilities and support using funding from a new sponsor. So that's an example. And thank you for that. That's where our community edition can really pay off, and where those entering an engagement with LabKey can have confidence that despite perhaps rocky funding in the future, there is a solution for continuity of research. So thank you very much. As a reminder, this has been recorded, and you will, in the next couple of days, receive an email follow-up from LabKey with links to the recording and also opportunities to engage with us if you so choose. Thank you very much. Have a great day.